Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Friday, April 3rd. My name is John Bradford. I'm your briefing call moderator. I'm a small business owner right here in North Mecklenburg, and I'm also a former member of the North Carolina House of Representatives. The purpose of this call and the series of these calls is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to help update, educate, and support the North Mecklenburg region during this outbreak. Just a couple things from the President's office. They have a mandate, 30 days to slow the spread. We are in day 18 of that 30-day initiative. As you can see on your screen here, you have the CDC website. That's a great website to go to, as well as coronavirus.gov. Just remember, if you're feeling sick, please stay home. If you're older, please stay home and away from other people. And there's a picture of an iceberg here, and I think that picture really says it all. We don't know what's coming, but there's a brunt of something big that's on the way, and we just need to be smart and we need to be prepared. We are not out of the woods yet, but just keep sort of this visual in your mind over the next few weeks, because all the forecasts that I'm reading and seeing says that North Carolina is not going to peak here until end of April, maybe even early May. So there's more to come, folks. President Trump announced social distancing is required through April 30th. There's a graphic on your screen, and it shows how just one person practicing social distancing can easily cut this down in half. You can see how if one person impacts two people, how those two people then impact other people, and it goes on and on and on. So just by being smart and truly practicing social distancing, we can continue to keep this pandemic at bay to help flatten the curve. Social distancing does work, but we need to practice it in all aspects of our lives. Just a friendly reminder that the CDC and Apple together developed a software tool that you can use to screen yourself, or you can use it to screen someone else. So if you have a loved one or a friend, it is a software tool, folks, but it does help at least give you some direction. The idea is this keeps the number of people from running to emergency rooms or even calling doctors right away. It's a guidance tool. Obviously, if you feel sick, call your doctor, but this tool is here for your use. In terms of the U.S., this map, you can see a heat map. This is updated at 4 p.m. every business day. So the last update was yesterday, April 2nd at 4 p.m. It was reported over 213,000 cases in the U.S. and 4,513 deaths. That's an old number already, because this thing is changing literally by the minute, but this is the latest data from the CDC as of 4 p.m. yesterday. Just a quick federal update. We all know that the Coronavirus Aid, Relief, and Economic Security Package, also known as the CARES Act, was signed into law on March 27th. If you're an employer, the Payroll Protection Program, which is just one of a handful of products that are out there, my understanding is today is the first day to be able to submit your loan request. And my understanding is, there's going to be a run on this. So don't delay. If you're an employer, if you're even an independent contractor, you'll be eligible to submit a loan as well. But it authorizes up to $349 billion. It's basically it covers 8 weeks worth of payroll. You can get a loan of up to 2.5 times your monthly payroll to even help with rent costs and utility costs or mortgage costs for a business. And this could be forgivable. So this could be a forgivable loan. So just please go to the SBA website. You can Google it, go to the Department of Treasury, and there is a new application that came out late last night. It's called the Payroll Protection Program, PPP. So I hope you'll take advantage of that. There are some guidelines, so be sure you understand the guidelines, but you can't get the money if you don't apply. Senator Tillis, on his website, he has a great link here just to show you that for North Carolinians, married couples can get a $2,400 check, $1,200 for individuals, and you can also get $500 per child. But just know that there are income thresholds, and you can see that right here on your slide. So if you are curious about what you are eligible for with the CARE Stabilization Package, you can go to Senator Tillis's website, and he's got it spelled out for you right there. On the FEMA rumor control, there's yet a new rumor that's out there, so please check the rumor control website so you know fact from fiction. The latest rumor, I'll read it to you. I got a call, text, or an email saying that I could get financial help. Is it legitimate? And so the answer is there have been reports that scammers are pretending to be the government. They're contacting people by robocalls, text messages, emails, social media outreach, and other ways. These scammers say that they can get you financial help during the pandemic, and then they ask you for money, or they're asking you for personal information like Social Security numbers, bank account information, credit card information, or even Medicare or Medicaid information. Folks, this is a scam, period. It's a scam. Do not fall for it. Tell your friends, tell your loved ones. Do not trust anyone who's offering you financial help because the federal and local disasters, they do not solicit you and they do not ask for money. So just, again, do not be scammed. Cannot impress that upon you enough. And this rumor just was posted on the FEMA Rumor Control website. For the North Carolina state, we're in an emergency still, and here's some phone numbers, and you can text 211 or COVID NC to 898-211 for additional updates on a real-time basis. The numbers just came out at 11 a.m. In North Carolina, we've had 2,093 cases, 19 deaths, and now 86 counties out of 100 have been impacted. And every call we've had, we've watched this heat map, which is on your screen. We've watched it go from white to light blue to darker blue, and so it clearly is impacting almost every county. There's only 14 counties left that don't have a reported case, but chances are they have a case, it just hasn't been reported yet or surfaced. So that's just important to know. And here are two statistics. COVID patients by age, and this is from our Department of Health and Human Services, 43% of patients by age with COVID are 25 to 49 years old, 43%. And then COVID-19 deaths by age, 65 and up, it's 79%. So you can get sick if you're younger, but if you're older, your chance for death does rise significantly. The point here is no one is exempt from this. Everyone needs to be smart. So please be smart and keep your social distancing because this thing continues to spread. And I think the worst is still yet to come. There's been no new executive orders from the governor since the last one regarding utilities, but we still are on a stay-at-home order at the state level. The North Carolina Department of Health and Human Services still needs volunteers. If you are a clinical person, a clinical support person, or even someone that does facility maintenance, safety, or administrative, we need your help. Here's a website right on your screen. You can go register because North Carolina needs you, and we need these frontline healthcare-related workers. Here's a website for the North Carolina Department of Commerce. So if you are an employer and you have questions, or if you're an employee that lost your, or former employee that's lost your job, you've been furloughed, reduced hours, you can navigate some of the Q&A right here on our own North Carolina Department of Commerce website. This is interesting because Mecklenburg is on a lake, Lake Norman. North Carolina Wildlife Resource Commission has put out sort of a friendly graphic here. So because it's going to look like be a beautiful weekend on the lake, please maintain your distance at boat ramps and fuel docks. Avoid using boat ramp docks while other people are on them. Do not beach your boat next to someone else. So no beaching your boats right next to each other. And no rafting ups. In other words, no tie-ups. Keep your distance on the water. This has been issued by the North Carolina Wildlife.org website, and you can go to that website, which you see right here on your screen. I know Commissioner Cotham in a few minutes will give an update on Mecklenburg County. Things are fluid. The last report that I saw was 533 positive cases and 3 deaths in Mecklenburg County. And Atrium and Novant Health Systems have sent a formal request to Mecklenburg County and their partners asking to build a mass care field hospital in preparation to treat as many as 3,000 additional COVID-19 patients during the anticipated surge. Folks, if that doesn't get your attention, I don't know what will. The hospitals are asking to see if they can build a mass care field hospital in preparation for what's coming. I know Commissioner Cotham will probably expand on that a little bit. And then there has been another clarifying amendment for car sales related matters. And you can go to the mecnc.gov website to get those clarifying orders related to the shelter in place or stay at home order. And again, even though the state has a order, so does the county. The most restrictive order dictates. So whichever order is more stringent, that's the one you need to follow. U.S. Congressman Greg Murphy has been a regular panelist for us. He cannot participate today because of other meetings, but we just want to, again, recognize and say our appreciation for him joining consistently. And Thomas Stith joins our calls every Wednesday from the Small Business Administration. You can go to sba.gov/disaster. So now we are going to go to our One of our regular panelists, Dr. Jack Faircloth, who's a medical doctor on the ground in Huntersville with the Holston Medical Group. He has been a regular on our panel briefing here, and so I'm going to turn it over to you, Dr. Faircloth.
Okay, thanks, John. And again, thanks for your leadership and just how well this is working. I'm hearing from patients and lots of people that they're getting great info through this forum. So today I'll just touch on the field hospital, the state of testing, any FDA approvals, more science on the spread of the virus, and just a reminder on the mitigation factors. So first point is that it is still true, and we're seeing data come in from everywhere. The more people that stay home, the more lives are saved. Remember, people, Mecklenburg County put an order in on March 26th. The incubation period of this virus is 2 weeks. So it takes 2 to 3 weeks to collect the data to see what staying home can do. So we need to just be patient. We need to take this a day at a time, sometimes an hour at a time, and hold tight to our staying home orders because it has saved lives everywhere it's been adhered to. Again, I agree with you, John, that the peak is probably going to be 3 to 6 weeks. So we are talking as far out as even mid-May from now. So we're not exact. Modeling disagrees, and so that's the range for the peak. I want to remind people that staying home costs other areas of our life. It might save lives, but it costs through job loss. There's tremendous burden showing up in our area, and there's other stresses. So, for instance, all businesses, as we know, are affected in Mecklenburg, but now even healthcare is affected. We're seeing physicians and nurses who are being furloughed as early as this Monday in Mecklenburg County. So just check on people who may be suffering through this particular aspect of the virus, even though they're healthy and without the virus, they may still need your support. The state of testing is still frustrating. It's very limited. I did mention on several calls that the FDA has approved the 5-minute diagnostic test from Abbott Laboratories, but I called all the ERs that I could before now and checked with hospital administrators, and we don't have those tests in our ERs. So the earliest turnaround test we have in Mecklenburg is a 24-hour test available at some atrium hospitals. You're hearing a lot about the spread of the virus being easier. In the beginning, it was coughing and sneezing that we're focused on, and the 6-foot distance certainly helps with that. But now, besides coughing and sneezing, talking and even breathing are scientifically shown to spread the virus within that 6 feet space. And so you will see, I believe, that the task force and probably the CDC will encourage patients wearing masks, or let me say that again, encourage the public to wear masks, especially probably in the hotspot areas. The key point here on wearing a mask, if that becomes a recommendation, we don't think it's going to be mandatory, but the key point is that a mask is to help us not spread it if we are asymptomatic carriers. That is, if we don't know we're sick. A mask does not replace any of the protective measures for ourselves and for our community that we have to adhere to. So masks are additive to existing measures. They help asymptomatic patients not spread it, but they do not help. They help individuals from spreading, not from receiving the virus. The field hospital at UNCC, we currently have 2,000 licensed beds to take care of patients in Mecklenburg County. The measure at UNCC will add 3,000 beds. That's using 6 dormitories. We're not sure if it'll just be, some will be to house increased need for medics and paramedics to stay away from their home, but it will help the area tremendously. The summary is still stay at home, social distance, wash hands. If you do wear a mask, it's not medical grade, not N95. It is to help you not spread if you don't know you have the virus. We thank everybody for their prayers and support from the healthcare community, and we especially thank everyone for staying home.
Thank you very much, Dr. Faircloth. And again, thank you for being on the front line, and please express our sincere appreciation to all your colleagues at all levels of the healthcare system. We can't do this without you. Moving on to Mecklenburg County Commissioner Pat Cotham. Pat, the mic's yours.
Okay, thank you. Thank you very much. Just a few updates from Mecklenburg County. We're having a board meeting on April 7th at 6 o'clock, and we did practice for it yesterday where we're going to do it remotely through WebEx. So we'll see how that works next Tuesday. Hopefully it'll work okay. John mentioned the letter we received, or the manager received from Atrium and Novant about a hospital and about collaboration with UNCC. What he did not mention in his statement that I was curious about as I looked at this letter is they are asking for the county and the state of North Carolina to provide the funding and resources to establish a field hospital on the campus. So, you know, it's kind of like the devil's in the details. We'll see what that's all about and how much that's going to be. And in the letter, the hospitals say they have already reduced elective surgeries and have found more space in their hospitals, but they still feel that there's going to be a surge between mid-April and mid-May, and that's why they need this extra hospital rooms, and that they feel that the additional volume is going to be 3,000 hospitalized COVID-19 patients. So that is kind of alarming. But I did also hear that at UNCC they were thinking about having a place for first responders who might need to isolate themselves from their families to use space at UNC Charlotte. So they're still working that out. So I don't have any definite things on that, but I do believe it's going to happen, but we just don't know all the details. The county manager is just notified the board that she's going to do a press conference today at 3 o'clock, and I know it'll be on television as well as being available through the website. And she's going to also have the health director, Gibby Harris, the fire chief, Graham, and CMPD deputy chief Estes will be with her, and they're going to cover topics about the, she's going to talk about more about UNCC and the plans around that. And she's also going to provide a new map and talk more about this medical surge. And then law enforcement will talk more about enforcing of the rules. And she's also going to talk about more aggressive marketing to fragile populations, which I believe she means homeless population, to help them, because we do have the virus within the homeless population. And how do we, get more communication, since they don't have access to the internet, and many of them don't even have phones. So I'm sure she's going to talk more about that. I was happy yesterday that I mentioned last week that I had been working on heavily on the needs for the car dealers and for the realtors and builders in home sales. And we did get yesterday an update from the county where they had changed some of their direction for the car dealers. So I think the car dealers feel like all the response I've had is they can work with this, so they feel better. And so I'm glad about that. I also want to give credit I reached out to the governor's regional director here in Charlotte, Kevin Monroe, also for that. And right before this phone call started, I received an update on home sales. And it's several pages long, so I can't say that I've even read the whole thing because I just got it. But I will send it to John Bradford after this call. But it does look like from what I can see here, that they have listened to the Realtor Association and the MLS, the Canopy MLS, to make it more workable so that homes can be sold and safety can be in place for the buyer and the seller and the agent. So that's progress. I doubt if they got everything they wanted, but it looks like they did get enough so that they can go forward to help people with home sales. And that's truly, to me, cars and homes are very essential. So I'm glad that we got some resolution on this. So that's all I have from Mecklenburg County. And I do ask you to tune in at 3 o'clock when Dean is going to give an update. Thank you, John.
Thank you, Commissioner Cotham, and thanks for all that you do and for being a part of this panel every time we have our call. We appreciate you. Now moving to Cornelius, Mayor Woody Washam. Mayor, if you're on the call, we'd love to hear an update from you, sir.
Thank you, John. I'm right here. I'm glad to be here. We continue to really work hard to educate our citizens on the importance of this social distancing aspect. I think most folks are abiding by it, but we still need to keep beating this drum, and I hope all my colleagues on the call will do the same thing. Nothing more important right now. We're pushing information out as fast as we can with reminders for the weekend, including keeping the social distance on the lake as well, and in our parks and greenways. That was certainly a challenge last weekend. It's going to be another pretty weekend, so let's pray it goes a little bit better this time around. I believe it will, because I think the communications keeps pounding on that particular aspect. Also, we continue with some really wonderful acts of kindness that's going on. They include actually several new items that I haven't noted. One is one of our former commissioners, Kirk Noss, and his company, ValWorks, which is a local business here in Cornelius, has donated 300 surgical masks for our public safety departments here in the town. They were needed, and he stepped up with that. Harvey's, one of our popular restaurants here, is providing free meals to all of our first responders and healthcare providers as well. I imagine they're doing that in Huntersville also. Cornelius Today, one of our local media outlets, is encouraging the town to participate in what's called a thank you campaign to our healthcare workers, and all are encouraged to step outside of their homes at 7 p.m. today and make some noise for hardworking healthcare workers. Ring a bell, clap your hands, just make some noise for this great group of folks that we're so dependent on right now. I do want you to know that our Connecting Cornelius occurs every first Monday in the month, typically at Harvey's restaurant. It certainly will not be there this time, but we're going to do it virtually for the first time. There is a Zoom connection link out on all sorts of Facebook pages. It's on the town's Facebook page. It's on my Facebook page. I've shared it pretty liberally in and around everywhere. We've got a great group of folks, starting with Senator Tillis, our state representatives, on down to our county manager, Dina Dioria, who Pat talked about a minute ago, and then our town manager and myself will be involved on that as well, just providing an update. There will be opportunities for the public to ask questions by text or email. So that's a little different concept. We'll see how that works, but we feel like that's important to allow them to do that. Also, one other, I guess, announcement, if you will, that I'd like to put out there is my brother-in-law owns a company up in Yadkinville, North Carolina. It's a textile manufacturing company, and they are beginning the manufacturing of masks. They're not surgical masks, but they are the protective masks that you can wear. I tend to think we're headed more and more in that direction every day as I listen to the president, the governor, and everybody else. That does maintain some value, it appears. So they're manufacturing. Their orders have been horrendous to date. He sells them for $1.50 a piece. So it's $1.50 a piece plus shipping. I'll give you the phone number, which you can call in your order if you so desire. It's 336-679-4400. 336-679-4400. Again, that is Endura Mills out of Yadkinville. So kudos to them for stepping up and serving this segment. Their other production has slowed down, as many have, and so they're taking it up in this particular category. That's it, John. Thank you.
Thank you. Thank you, Mayor Washam. Appreciate it. And thanks for being a consistent panelist for the series of calls. Now going to the town of Huntersville, we have Mayor John Aneralla, who's also been very consistent on these calls. We appreciate you for your leadership. Mayor, the mic is yours.
Well, I look forward to these calls. There's not a lot on my schedule these days, but I also learn a lot too. Reiterating what Commissioner Cotham said, real happy the car dealers and the realtors are having a little more flexibility within the current situation we're in. I think if there's another business out there, you all just have to be patient. We will try to work through the situation and the guidelines, and just have to be patient right now. Everybody's learning as we go. As a town, I just did a very quick meeting today in order to allow us to have virtual meetings starting Monday. So Monday at our regular 6 o'clock meeting, it will be virtual. If you would like to participate in that meeting, you have to go to our website and sign up by 2 o'clock on Monday. Our parks are going to be a little more restrictive, similar to what the county has done. So no tennis and basketball. You can still walk around the parks, but you can't congregate in groups. And please just walk and take the greenway and walk and enjoy the parks as they are. Also, it's anticipated that we will align ourselves with the governor and extend out until April 30th. We are now there until April 16th, so I anticipate that. A couple other things I would like to talk about. One is went by Angels and Sparrows today, and they're open from 11 to 1, Monday through Friday. They're seeing increased customer service as the weeks go on, and we anticipate that they'll need, as well as other food pantries, additional financial help. If you want to participate at Angels and Sparrows or any other charity, or get a update on what's going on, the county has a great website, charmecresponds.org. And then finally, in these times when everybody is very close together and there might be already some conflicts within your family, there is a phone number, 980-771-4673, the Greater Charlotte Hope Line. That's there for any type of abuse or situations that you might feel uncomfortable in your current circumstance. So that's really all I have. Have a wonderful weekend, everybody. Stay healthy, stay away from each other, and enjoy some good weather. Get yard work done.
Thank you, Mayor. We appreciate you joining these calls. Be safe and healthy.
Okay. All right.
There's no one from the town of Davidson on the call. All I'll say is, it's an open invitation. I've reached out to the mayor as well as the town manager, just letting them know we have these calls. Unfortunately, no one's ever joined them, so we'll leave that invitation open. And if any of the listeners here would like Davidson to join, then I encourage you to reach out to the town of Davidson and ask them to send a representative. As you can see, Cornelius and Huntersville have sent their mayors, and it's been very helpful. And we would hope Davidson will start joining us. We'd love to have them. Rhonda Lennon, our board member, she said there were no updates for CMS. She's joined our call quite a few times, so really no new updates to report from her. But you can see there's a hotline here for lunch and also for internet. If you need internet, please call that hotline, 980-343-6041. And then lastly, the Chief Executive Officer of Lake Norman Chamber of Commerce. I think he's out he's practicing some social distancing on a farm today, so we're glad you're here. So Bill, I'll turn it over to you, sir.
I have been stopping in from time to time. I had a radio interview today with WSIC, Joe Bagnone's Local Biz Now, and we had a great conversation with Nicole Greer, and now this program here. The Chamber of Commerce had a great program. I talked about it the other day on Wednesday. It was on the Families First and Care Act that Jay Leesman, a Huntersville CPA, walked through. A lot of great slides, some good information. All of that is up on our website at lakenormanchamber.org. You can go there and see that presentation. On Tuesday, we're going to revisit that issue, the CARE Act. It's a fluid and keeps changing. It's an ongoing process, so we want to continue to hit it. Dale Gilmore is going to walk through the CARE Act and how businesses can get the assistance they need, employees can get the assistance they need. Again, that's going to be Tuesday. There's going to be a Zoom invitation to our chamber membership. However, it's going to be recorded, and it's going to be sent out, put on social media, put on our website so folks can see it. On Wednesday, we're going to have 12 of our area nonprofits highlighted. What are their needs? What can you do? What are they doing during this particular pandemic? So we're going to have that on Wednesday. Once again, it will be a Zoom call that we record, and then we'll send it out on social media so everybody can see it. John, the last thing I can say is, this is a very challenging time, but every morning when we get up and every night when we put our head on the pillow, that is just one day closer to this being over with. And we will get through it. We will get past it. And as our president has said, and I truly believe, we're going to emerge from this a stronger country. We're going to get our businesses back rejuvenated and going again. We will get there. In the meantime, there's a lot of stuff that's being handed down from Washington and Raleigh that can help our businesses and help our employees. I encourage you, please go to the Lake Norman Chamber of Commerce website, www.lakenormanchamber.org. We are continually updating information there in terms of assistance from the SBA, from the federal government, and the CARE Act. And we also have a list of those restaurants. And I encourage you tonight, instead of cooking something at home, support our restaurants. A lot of them are having drive-throughs, takeout, delivery. Please support our local restaurants. There's some great ones out there. And by helping them, you're helping our community. You're helping yourself. The job that you save might even be yours. So again, John, thank you for what you're doing, and thank everybody out there for supporting our local businesses.
You bet. Thank you, Bill, for your leadership. And right here on the screen, you see the Lake Norman Chamber website. Lots of information there. And Bill, your words of hope and positivity are very welcomed. So thank you very much.
Thank you, John.
Again, you're very welcome. We also have an open invitation to the Huntersville Regional Chamber. I have their website here, so we keep that invitation open. If anyone from that organization wants to join our call, we'd love to have updates. So if any of our listeners have some influence there, ask them to join. But here's their website. I'm sure they have some great information on their website that they update regularly as well. Our next briefing is Monday, April 6th. Just one thing I'll say is we are stronger together. I think there's a lot coming at us, but let's just be smart about it. Let's take care of ourselves. Let's take care of each other, and say a prayer. Nothing wrong with that. If you have a concern or you want to have something covered on this call, shoot me an email, lkntogether@gmail.com. That's lkntogether@gmail.com. Stay safe and healthy. This concludes today's briefing call. Thank you.